Hello, I am Dr. Ali Karahan. I am a hair transplant doctor. I have been performing hair transplants for over 10 years. Patients come to me from Turkey and all over the world. We address the issue of baldness, enabling people to continue their new lives with hair. Hair transplant is the process of transplanting hair to the area on our head where it has fallen out, known as male pattern baldness. We collect the hair from the area where it does not fall out with its roots and place it in the bald area by opening channels. This process is called hair transplant. Interestingly, when you transplant hair with its root to a new area, it grows again. The root settles and thrives there. Hair transplant can be done for both men and women. When we talk about male pattern baldness, we refer to the baldness in the front and crown areas, which we consider as male pattern baldness. If a person has hair follicles sensitive to the hormone testosterone, their hair will fall out. These areas are the crown and front regions which are affected. The hair at the back is not sensitive to this hormone. We overcome baldness by transplanting hair follicles that are not hormone sensitive to the front. Currently, we use two hair transplant methods. These are the FUE method and the DHI method. The FUE method stands for follicular unit extraction, which is a modern technique. We collect the roots one by one from the donor area at the back of the head using a micromotor. We open channels in the bald area for each root we collect, and then we place the hair roots into these channels. This method, known as FU, is what we call it. In the DHI method, we also collect roots one by one from the same donor area using a micromotor. We use special pens, which we call DHI pens, to place the collected hair into the scalp. We insert the hair into these pens, known as Choi pens, and then place the hair into the scalp using these pens. The FU method involves 3 stages, while the DHI method involves 2 stages. Both methods are very successful. We determine the method based on the patient's hair count and type. We achieve very successful results with both methods. As we know, everyone talks about men's hair problems, but women also have significant hair issues, just as much as men. There is a medical treatment part and a surgical part, like hair transplantation. If a woman has male pattern baldness, we prefer hair transplantation for her. In women, baldness also occurs in the front and crown areas. Medical treatment does not help in these cases. Hair transplantation is a definitive treatment. However, we also apply medical treatments for general thinning and hair loss. Additionally, we perform eyebrow transplants for women. We collect fine and single hairs from the back of the head and transplant them to the eyebrow area. Now, I want to talk to you about the hair transplant process. If we consider doing a hair transplant today, we start the surgery in the morning. The individual goes home or to their hotel in the evening quite comfortably. They have their meal, rest, and relax. There is no need for hospitalization. We perform the procedure under local anesthesia. The next day, we see our patient again, evaluate them, and renew their dressings. And the following day, we perform the first wash, which we call the initial wash. During this wash, we explain how to wash the hair, how to wash it for 10 days, and how to clean the scabs during this period, step by step. We specify in writing and verbally what to pay attention to and what to avoid. After doing these, the first 12 days are very important for us, for those hair follicles to properly integrate and settle into that specific area of the skin. Once this process is completed, the individual can resume their normal daily life activities. Approximately 12 days after the hair transplant procedure, it becomes unnoticeable that the person had a hair transplant. The scabs are cleaned off and the wounds have healed completely. However, when we examine it microscopically, the initial healing of the scalp takes about a month. Swimming in the sea or using the sauna can be planned by the individual after a month has passed. If we ask what a successful hair transplant is, as a doctor, my main goal is to ensure that the person who had the transplant looks natural. Even I, as a doctor, should not be able to tell that the person had a hair transplant. This is the main goal, a natural looking hair. There are a few key points here. Professionalism and experience are crucial in this field. 3 points are very important for us. The first one is the front hairline. We design a hairline that suits the person, their age, and their future lifestyle in a suitable manner. That hairline ensures the person looks natural in later years. Secondly, the direction of hair growth is extremely crucial. We know this from our experience. It should be as horizontal as possible. In certain areas, there are specific directions. We open the channels accordingly. Lastly, the density of the person's hair is also very important. It needs to be at a certain density. We strive to achieve that density. When we combine these 3 points together, we achieve a successful hair transplant that looks natural. Thus, people overcome the fear of whether it will be noticeable or if everyone will understand. As I mentioned, one of my main goals is that even I should not be able to tell that the person had a hair transplant. Hair transplantation is indeed a serious matter. Our hair is always in a place where people can see it at all times. Therefore, it needs to look as natural as possible, as much as it can. It should be done by skilled individuals and doctors who pay attention to these points. The person must take care of themselves in this regard.